two.
Hi everybody, I'm Ryan Seedall and just wanted to talk for just a minute, give you a little bit of background about the attachment primer article that I did with Karen Wampler in JMFT. Give you a little bit of the story behind the story, I guess. Pretty much attachment theory was an interest of mine even in my master's degree. And I kind of graduated from my master's degree feeling like I had a pretty good grasp of attachment theory and what it was. And then I worked for a couple of years and then started my PhD actually at Texas Tech University. And during that time, Karen Wampler had a number of projects that I worked with, all centered around attachment. And one was a coding project of a Q-sort that she developed. And in the course of that, I got to really see the practical nature of attachment and how it can play out in couple relationships and in our interactions. And so even in the year I was working with her at Texas Tech, it became clear that how much I didn't know about attachment theory and how much there was to learn. And so I started to learn, and we definitely talked about different ideas of things to do for my dissertation. And they all centered around couple interaction, attachment theory, and looking at the relationship there. The attachment primer article is a core part of my theoretical rationale for my dissertation. And in many respects, it's very gratifying for me to see it published because it kind of demonstrates some of the growth that I feel like I made in understanding attachment and seeing its relevance for couple therapy in general. You know, you're going to be able to read it, but I just wanted to highlight maybe one or two things. I think probably the thing that is most important, or the thing that has helped me the most in attachment theory, it's very broad, but just this understanding that a lot of times we think about trying to change attachment in our therapy, in what we do in therapy. But in reality, I kind of like thinking more about how we can use attachment to inform our therapy and really think about how to adapt what we do to different attachment strategies. And I think the very best, most intuitive therapists do that. But my goal in a lot of the research I'm doing is to try and kind of standardize that a little bit so that we can understand a little bit more about what to do when we're working with different clients and their different characteristics. So hopefully that gives you a little bit of background and a little bit of context as you read this article, and I hope you enjoy it.